And we're going to get rid of it through urine and feces. Oh, cool. So this is what it looks like for the life cycle. Life cycle, we got to make it. We need the bone marrow to do that. They circulate for roughly 120 days. We're going to control how much is in the blood based on what the kidney, how much oxygen gets to come through. Once they make it to the spleen for disposal, these are the steps that occur. The globin portion, we break it down into the amino acids. Heme, the iron portion, will either reuse or will store. Some of it will get lost through bleeding, menstruation, that sort of thing. The heme itself is going to go through these steps and will excrete it out as a waste. Kind of cool. Some of the disorders that are going to come along with red blood cells. Polycythemia, an excess of red blood cells, having too much. You kind of think, well, whoa, wait a minute. Can we really have too much? Yes. If there are too many red blood cells, the blood's going to be too thick, movement's going to be difficult. Primary polycythemia, for the most part, it's a cancer in the blood. It deals with that erythropoietic cell in the bone marrow. It can make counts go way too high. When it should be 4 to 6, 4, 5, 6 million, we're over double that amount. Think about your test tube and the shaking down of the test tube. That part that should be the red blood cells, think about that number being double. What does that leave as room for plasma and white fluffy coat? Not much. Okay? So you're basically, even though there's a huge supply of the red blood cells, there's a decreased supply of iron, all the nutrients that would be in the plasma portion. All right, so that's not a good thing.
Do you even have white blood cells at that point? Like if it's pushed?
It would be, but that's still a small portion, and it would decrease the area for the plasma,
Okay.
which would be all those nutrients and everything that need to get to the cells for the cells to use. If it's secondary polycythemia, it can be like maybe you're just dehydrated. You need to drink some more fluid. A lot of times when you go have blood work, and if you're BUN, BUN, okay, but that stands for blood, urea, nitrogen, okay, that's a little high. It could have been just because you were dehydrated and you need to drink more fluid. Emphysema, one of those lung diseases. The high altitude, because your body is having to make more red blood cells, or look at this, physical conditioning. A lot of our athletes will go train. This is their way to get around the blood doping. They'll go train in very high altitude areas. And when it's time for whatever they're training for, the race or whatever the case might be, they come back down to the area for the races or activities or whatever, and they're loaded with red blood cells. It's a form of blood doping. Because blood doping is being given, the one that's illegal, well, it should both be, but anyway, the one that's illegal means you've been given erythropoietin to produce red blood cells. Going to the high altitude training is just a way to get around it. The dangers of the polycythemia: the blood volume, of course, increases. This is going to play a part on the pressure from my heart. It's going to affect how fluid my blood is through the vessels. It can lead to an embolism, a stroke, or heart failure. So if people get diagnosed with the primary, they're usually placed on medication. Sometimes it helps. It's kind of tricky. The secondary, usually altering the lifestyle, can affect it. Now, what if we have enough red blood cell production, but there's not enough iron on the hemes? This is anemia. We can either have not enough red blood cell production, or the synthesis of the hemoglobin is not correct. There could be kidney failure, which could affect it. We can have not enough erythropoietin, iron deficient, one that's really the term that you might hear clinically. But there's a couple, there's 3 categories that fall under anemia: pernicious, hypoplastic, aplastic. Pernicious. This is autoimmune. The body is attacking its own cells. It attacks the stomach tissue. We don't take in B12 correctly, and B12 is important for the red blood cell production. Hypoplastic. Well, anytime you hear hypo, not enough. Red blood cell production slows down. If it stops completely, because A means without, this is aplastic. That'll lead to death. If we don't have the red blood cell, think about it, the whole series of events of oxygen to the tissues not available. Hemorrhagic anemias, this will be coming from bleeding. So, for example, trauma, all right? There's been too much blood loss, and the body now needs to either compensate for it, or you need blood. A hemolytic. Hemolytic. Lytic means to lyse, to cut in half, okay? This would destroy the red blood cell. That's not good either. All right? I don't think any of them sound favorable. Just saying. Okay? Because even the one that we think of as like the most common, the iron deficient, I mean, even with that, it's not fun. I mean, people are tired. They might have to take iron. All that stuff. It's not fun. Well, sickle cell, because the red blood cell is not formed correctly, and the hemoglobin has an issue, has to do with that. Yes, blood cell transport of oxygen becomes insufficient. I would have to look that up before I answer it. No, for sure. That they could still have red blood cells that are functioning correctly, and the sickle cell could be in remission or not. So that's usually how it goes. I have to look into that. But I think for the most part, people who have it do have anemia.
So if you take like a B12 vitamin
Mm-hmm.
or the shot,
Mm-hmm.
so is that just the reason why it like gives you energy is because it's producing more red blood cells?
Yes, you're getting the hopefully proper production of red blood cells.
Okay.
Yeah.
It just boosts it. Okay.
Mm-hmm. It'll give it a little bit of a boost. The consequences of anemia: tissue hypoxia, not enough oxygen. And if that happens, tissues necrose. They die. So when you hear the term necrosis, that's death. Usually, patient is lethargic. They get short of breath. If it becomes too severe, because think about this, every cell of the body needs the oxygen. You take that away, okay, if it begins to affect the brain, the heart, or the kidneys, it can kill you. Have you ever kind of like just felt foggy headed sometimes?
Oh.
You know, like, oh man, I can't do this. A lot of times, if you stop and take some deep breaths, because for the most part, we don't breathe correctly, okay? You know, people who do yoga, they're really good at it, okay? The rest of us, we're really bad at it, all right? And you're not getting enough oxygen to the brain. And that leads to this foggy feeling and stuff like that. So sometimes you just need to stop and take a breath. Blood osmolarity is reduced. That means fluid will move from the blood into the tissues. This creates edema, the swelling. And that's not good for the tissues. The viscosity, the flow through the tubes, that gets lowered. Heart races, blood pressure will drop, and in severe cases, cardiac arrest. And one thing I always tell my students, it doesn't matter what led to death. Death is always the heart stopped beating. Have you ever thought about that? Yeah. Doesn't matter what could have led up to it, what disease, trauma, or anything. The fact comes down to the heart stopped. That was it. Sickle cell. We've mentioned this quite a few times. We've talked about it being recessive. We've talked about the shape of the sickle cell. We mentioned that it was due to that 6th amino acid being incorrect on the hemoglobin chain. Oxygen is not going to bind well to the hemoglobin in the sickle cell. Those red blood cells get rigid, sticky, pointed at the ends. This is why they can clump together in the small blood vessels and capillaries of the body. And it becomes very painful. And it can affect anywhere in the body. Because of the fact of what it does and how it acts, it can affect any part of the body. Eyes, brain, kidneys, heart, joints, Okay? Because, I think we mentioned this, they believe this is an evolutionary trait that people who have sickle cell are immune to malaria. And can't say one's really better than the other, that's for sure.